Good morning. My name is Brian Mankim, and I'm an Associate Professor of Epidemiology and Biostatistics at Fiji School of Medicine, or formerly Fiji School of Medicine, now known as Fiji National University. And I'm going to be talking to you this morning about a leptospirosis prevention project that we want to develop in Fiji. And in particular, I'm going to be specifically speaking to the Australian Agency for International Development, a long-time partner with the Fiji School of Medicine, without which we could not undertake many of the projects that we do. So I'll be speaking specifically to AusAID this morning, giving them some background, and then giving them a couple of top reasons that we would like them to partner with us to develop this leptospirosis prevention project. All right. So there is a long-standing history of cooperation between AusAID and the Fiji School of Medicine. AusAID has long supported our medical education efforts. We are the primary provider of physicians, nurses, physical therapists, clinical laboratory scientists, public health professionals, and so on and so forth throughout the Pacific, and AusAID has always been there to support us in those efforts. They've been here to support us in our medical research efforts as well. Similar programs in infectious diseases dealing with dengue, malaria, even yellow fever, chikungunya, etc., and also chronic diseases such as type 2 diabetes. They've also been wonderful with us in terms of knowledge exchange, in terms of helping us build our capacity to conduct a better research. All right, in terms of capacity building and knowledge exchange, they've also been fabulous in partnering a number of professorial level exchange programs between University of Queensland, University of Western Australia, Edith Cowan University, and so on and so forth. And so really what it comes down to in terms of this long history of producing medical practitioners going back almost 150 years here in the Pacific is that without AusAID, there's no Fiji School of Medicine. So what we'd like to reinforce this morning during this presentation is that we'd like to keep this partnership strong. We'd like to keep it going as we move into this new era of leptospirosis prevention. All right, so leptospirosis is very common in Fiji. Why? Because when we get into our rural areas, we see a lot of dairy cows. Now, dairy cows tend to be one of the primary carriers of leptospirosis. We also see leptospirosis in cats, dogs, a lot of rice and things, or not rice, mice, and things like that. But in terms of exposure, we think it's primarily the dairy cows in the rural areas. So what we see is we get these infected cows, they urinate in standing water in the fields, and then not surprisingly, we have the farmers in the fields working with the cows, working with the crops. Without shoes on, they're exposed to the leptospirosis, and so we kind of get this cycle of repeat infection in the populations. All right, so what underlies this issue with leptospirosis in the Pacific? Well, we have issues with global climate change, okay? Increasing problem here in the Pacific. We're seeing a lot of new research supporting climate change. We're seeing a lot of new research supporting the fact that we're seeing many more climactic events like increased flooding, longer rainy seasons, so on and so forth, that increase the amount of standing water that we see. All right, along with that has come a year-by-year steady increase in the number of cases we have. As of 2012, we saw 512 cases and 52 deaths. Now, as we come into 2014, we've already seen our first major flood season. And so we're expecting the leptospirosis cases to start peaking soon. All right, it's important to understand that in terms of control of infectious diseases like leptospirosis, that we're dealing with a broad range of infectious diseases all at once here in Fiji. We're currently in the midst of a dengue outbreak. All right, and so we're in the midst of trying to deal with this increased number of cases of dengue, and yet we're expecting, without the dengue cases subsiding, a sudden peak in leptospirosis. And so the worry is that maybe we're going to overwhelm our surge capacity. That's why prevention, as most public health people understand, is so important. All right, so how do we prevent it? Well, it's really easily preventable, and simply we reduce the exposure to the standing water. Of course, there's some zoonotic techniques where we go in and we do some zoonotic epidemiology and we look at treating the infected herds, but that's really cost prohibitive right now in Fiji. So our best bet is to reduce exposure by the use of rubber irrigation boots by farmers and others who are working alongside these cattle. So that's going to really be the focus of this program, is to increase education about the risks of leptospirosis and give these farmers working in rural areas access to the rubber boots. All right, so where are we going to look at this? You can see a map of Viti Levu there. That's the largest island here in Fiji. Fiji's made up of about 200 islands, but really only maybe about 15, 20 of them are inhabited. Viti Levu being the largest with the capital of Suva. You can see Suva in the lower right-hand corner down there. So we have what we call this Nosori medical subdivision. Fiji is broken down into medical subdivisions. Each come with a medical subdivisional hospital, a variety of practitioners, both in preventative and public health capacities. What we see in the Nosori corridor, that we like to call it, along what's called the Queen's Highway, that road you can see on the map there, is we see a lot of dairy farms. Rewa Dairy is located out there. So not surprisingly, in these areas, we see higher numbers of cases, along with the higher numbers of dairy farms. So that's why we've chosen the Nosori Medical Subdivision as the focus of our prevention program. All right, so if it's so easy to simply prevent exposure through the use of rubber irrigation boots, the question is, why isn't it working? Well, we think it's a threefold issue here. We think it's lack of education, cost, and availability. In terms of lack of education, we think that most of the farmers working in the rural areas simply have not been educated about the risks of leptospirosis, in terms of risk to them, in terms of risk of exposure. We think it's also an issue in terms of cost, in that the rubber irrigation boots are quite expensive. And we think it's availability. They simply are not available in the rural areas. If people want the rubber irrigation boots, they have to come into one of the major metro areas. And that's costly in terms of time, in terms of money for bus fare, taxi fare, et cetera, et cetera, et cetera. So we think these are the three factors that are coming together to make it difficult to prevent leptospirosis. So not surprisingly, those are the three factors that we're going to work on overcoming. All right, basically what we want to do is we want to undergo a paradigm shift. I mentioned before those three factors in terms of education, availability, and cost. That's the current paradigm. What we want to do is we want to shift our paradigm a bit, all right? So we have these two major populations that we deal with in the rural areas. We have our native Fijians, also known as Itakai, and then we have the Fijians of Indian descent who were brought to Fiji maybe 150, 200 years ago by the British colonial powers at the time to work as slave labor in the sugarcane and the other plantations. And those Fijians of Indian descent, they stayed. And now we see both cultures are highly entrenched in Fijian society, each with kind of separate cultural, economic, and even educational roots in terms of having different schools. So what we want to do is we want to go into the village and we want to have focus groups so that we can prove those three risk factors of cost, lack of education, and lack of availability. But we got to have focus groups with both the native Fijians, or the Itakai, and the Fijians of Indian descent to prove those separately in those two different groups as part of that first stage of the paradigm shift. All right, so then in the second phase of the paradigm shift, once we've identified those three factors, what we want to do is we want to develop culturally appropriate materials, all right, so that we can educate these rural communities about the risks and about the preventative steps that can be taken in terms of leptospirosis. Now, this is going to be based on a community-based participatory research model. So once we've used these focus groups to identify the factors, we're also going to use the focus groups to help us develop the materials so that it is more readily accepted by the community. Now, where are we going to put the educational materials? It'll probably come in the form of educational posters and things along those lines. Almost all of these rural communities have schools, they have churches, they have shrines for the Indo-Fijians, and they have community stores. And these are kind of the areas that form the backbone of social life in these communities. So once we've developed materials, that's where we want to present it. The other place we can present it in is in the community health posts. All right, the final part of this paradigm shift is simply we want to provide access to irrigation boots. And frankly, that is the major place where AusAID is going to come in. Providing access to the irrigation boots is going to be costly. All right, because we're going to have to find a way to bring these in large numbers, and currently they're not available in Fiji in large numbers. So what we're asking from AusAID, because we have separate streams of funding through our strategic fund at Fiji School of Medicine to fund the focus groups and the research and the background and the preparation of the educational materials, but our strategic fund will not cover the cost of the rubber irrigation boots. So that's where AusAID, okay? Like I've said before, AusAID is dedicated to Pacific Public Health. You have been there for us for nearly 75 years now. in various different formats through the Australian government. And like I mentioned at the beginning of the presentation, if there was no AusAID, there would be no Fiji School of Medicine, all right? You've been a consistent partner with us. You've helped us with our infrastructure. You've helped us with exchange and continuing education for faculty members. You have the financial and technical expertise that we need at this point to help us make a difference in terms of leptospirosis prevention, all right? And we know that you share the passion that we have to change public health in the Pacific. Australia and the Australian government and AusAID are very focused on the Pacific in terms of taking a leading role. And as I say down there in the corner, it's important to remember that our health security is your health security. I mentioned earlier that we're in the midst of a dengue outbreak right now that we're handling relatively successfully, but the concern is that as the leptospirosis begins to peak, that we're going to see an overwhelming of our medical capacity here locally. Now, in the short term, you know, Australia is there. They can help us with those things. But what we're really asking for is from Australia AID is that you help us with the long-term issue of preventing leptospirosis so that in the future we don't have to worry about this issue of surge capacity and being overwhelmed locally. All right? So we need your help. We want you to continue to partner with us and continue to help Pacific Public Health grow and be stronger. Alrighty, so what do we come down to in conclusion? Well, we know that rural dairy farming is important. We know that there's lots of cows out there. We know that we have increased climate events, flooding, tsunamis that have all led to increased exposure to the leptospirosis, which has in turn led to increasing number of cases. And we know that leptospirosis can be easily prevented through the use of rubber irrigation boots and appropriate education in the communities. But like I say there, we can't do it alone. We absolutely need your help to make this a success because simply put, we can't afford to get the rubber irrigation boots to these communities without the assistance of AID. And without the assistance of AID, this program will fail. And we will continue to see increasing rates of leptospirosis in our communities. So when it comes to the Pacific, our health security is your health security, and we look forward to a growing and strong partnership between AusAID and the Fiji School of Medicine in terms of leptospirosis prevention now and in the future. Thank you.